Hi, I'm Dr. Russell Kerr, and welcome to our health channel, and also to reveal the science behind various health topics. So today's topic is about
Welcome back to the Better Health News Channel, where we dive into the latest research that supports a world of better health and wellness. Today we're going to talk about a study that's making headlines, and for good reason. Researchers claim to have found a way to predict heart attacks in women a whopping 30 years in advance. Yes, you heard that right, 30 years. So let's get started and explore what this study is all about. Heart disease is the #1 cause of death, with cancer being number 2. When it comes to heart health, we often think of men being more at risk, but the reality is that heart disease is also the leading cause of death in women. According to the American Heart Association, heart disease kills nearly 1 in 5 women every year, and since women have more early subtle warning signs of an impending heart attack, which are more often dismissed, they are least likely to survive a heart attack. Please check out our video on the early heart attack warning signs for women. So it's time we start taking women's heart health more seriously. One of the biggest misconceptions is that heart disease only affects older women. But the truth is that heart disease can affect women of all ages, even young women in their 20s and 30s. Another common misconception is that heart disease only affects women who are overweight or have a family history of heart disease. But that's not the case. Heart disease can affect anyone, regardless of their age, weight, or family history. So, what can we do to reduce the risk of heart disease in women? Well, that's exactly what this study aims to answer. In a recent 2024 study published in the prestigious New England Journal of Medicine, is a study that followed almost 30,000 women for 30 years. Blood samples were taken back in 1993, and then the women were followed for the next 30 years. The study found that specific biomarkers in the blood can be measured to predict a woman's future risk of heart disease. The important markers in the blood panel tests were the LDL cholesterol level, high-sensitivity C-Reactive Protein or hsCRP, and lipoprotein A. The strongest predictor of heart disease in the study was the C-Reactive Protein level. C-Reactive Protein, or CRP, is a protein made by the liver that rises when inflammation occurs in the body. Chronic low-grade inflammation is a known contributor to the development of hardening of the arteries and atherosclerosis, which is the buildup of fatty deposits in the arteries. Since inflammation can cause heart attacks, it is now known that high blood levels of CRP are a strong predictor of risk for heart disease. LDL cholesterol, also known as the bad cholesterol, is a waxy, fat-like substance made in the liver. We want our LDL level to be low. The body makes all the cholesterol it needs as building blocks for our cells and hormones. However, too much of it can clog our arteries and raise the risk of heart attack or stroke. Lipoprotein A is a type of low-density lipoprotein that carries cholesterol through the bloodstream. It is unique in that its gene is inherited and passed down through families, leading to a greater risk for heart disease in certain ethnic groups, especially those of African and South Asian descent. It will also increase with diabetes, chronic kidney disease, and postmenopause. This study put together these 3 blood tests and looked at them in a unique way. The study revealed that women with the highest levels of LDL cholesterol were found to have a 36% increased associated risk for heart disease compared to those with the lowest levels. Women with the highest levels of lipoprotein A, or LPA, had a 33% greater risk of heart disease. The highest levels of CRP put women at a whopping 70% increased risk, making CRP the most sensitive of the tests. And that is why women should ask their doctors to do this simple blood test to measure their CRP levels. The study also found that women who have elevated levels of all 3 markers were 1.5 times more likely to have a stroke, and more than 3 times greater to have heart disease. Usually most doctors will only order lipid panel tests for cholesterol and triglycerides and not CRP or lipoprotein A. With this new study, the medical guidelines will need to change. That means that you now must be more proactive in your healthcare and tell your doctor to measure your CRP and lipoprotein A levels. By analyzing these 3 biomarkers, researchers were able to create a risk profile for women that could predict heart disease up to 30 years before any symptoms might appear. What's even more impressive is that this blood test could be integrated into routine checkups. Imagine going for your annual physical and finding out your heart disease risk decades in advance. It could give you and your doctor the information needed to make lifestyle changes, start medications, or monitor your health more closely long before any damage is done. With this information, doctors can use it as a roadmap to target specific customized treatment plans. This kind of early detection and intervention is crucial because heart disease often progresses silently. Traditional screening guidelines usually do not identify at-risk women until they are well into their 60s or 70s. And many women might not experience any symptoms until a heart attack or other severe event occurs. But with this test, we can now shift from a reactive to a proactive approach, potentially saving countless lives. By making simple lifestyle changes, such as losing excess weight, exercising regularly, eating a balanced diet, and managing stress, women can significantly reduce their risk of heart disease. And that's exactly what's so exciting about this study. It shows us that heart disease is not inevitable, and that by taking action early, women can prevent heart attacks and live healthier lives. The implications of this study are huge. If we can identify women at high risk of heart disease early on, we can intervene and prevent heart attacks from happening in the first place. This could save countless lives and reduce the burden on our healthcare system. But you must be proactive and request your doctor to measure at least your high-sensitivity CRP blood levels. That would be a good place to start. Thanks for watching, and please share this video with your family and women friends. We would love to hear your thoughts on this study in the comments below. If you're interested in learning more about good health and the studies that support them, be sure to check out our other videos, especially our video on the heart attack warning signs for women. Remember our motto of think well, eat well, move well, and be well. And don't forget to like and subscribe for more content. So, until next time, take care.
Thanks for watching our video. And if you like it, please hit the like button and give this a thumbs up. So until next time, eat well, stay safe, and stay positive. Take care.